Hello, my name is George Bisset and I'm the radiologist in chief at Texas Children's Hospital. When we graduate from medical school, all of us take the Hippocratic Oath. And when we take that oath, we make a contract with society that says two things. One is, it says we're going to be a healer. We're going to take care of patients. We're always going to be concerned about the welfare of patients. But the second part of that social contract is that we will behave in a professional fashion. And part of being a professional is being a member of a professional society or organization. This is part of our contract because one of the advantages we have in our profession is we have the ability to self-regulate, which gives us a certain autonomy that few jobs in the United States have the ability to do today. If we look at the American Board of Radiology, they set the certifying examinations for us as radiologists. And how do those trustees get into that position on the American Board of Radiology? Well, they're nominated by our professional societies. Now today, in radiology, we have almost 60 societies, and these are all self-organized communities of practice. I'm not sure we truly need 60 organizations, but this is what we have, and these things are created by people of like interest. If we look at the beginnings of associations and we look at the beginnings of our organizations, they probably began somewhere with the 12th century guilds. These guilds were merchants and craftsmen that got together because they had a common interest. But it was really, if we look at the medical profession, it was really in 1847, over 150 years ago, that the American Medical Association had its very first meeting. And what they said at that first meeting was, we have a group of physicians, we're all interested in self-organizing, and what we want to do are three things. One, we want to advance the science of our practice. Two, we want to create standards for medical education. And three, we want to create the very first code of ethics for physicians. The bottom line is that if we look at that first meeting of the AMA, our first professional association, the bottom line is they were trying to help us to become better physicians. And they set a high bar. And even today, if you look at the organizations that we're all a part of, we're continuously trying to set the bar higher for us. So one of the important roles for societies and associations is to help us as physicians grow. If we look at some examples of how they help us grow, let's look at the national and international meetings. These are tremendous opportunities to help us network, opportunities to help us blend cultures. If we look at the international meeting that comes to mind for me, it's the Radiological Society of North America, where we collect almost 60,000 people from around the world. Those 60,000 people come from a variety of different cultures, yet they come to that same meeting to share ideas, to blend cultures, to share between generations. We have older radiologists that attend that meeting, and we have younger radiologists. So it's an opportunity for us to get together and blend our skills and our experience. These meetings also are a tremendous source of new energy, new ideas. If you think back to when you've attended meetings, or I can certainly share my experience with you, when I've attended one of these meetings, I'll sit and watch a scientific presentation, or I'll watch a didactic session, and I'll come away with renewed energy. I'll come away with ideas that I'll carry back to my institution that I can use as a springboard for more work, more investigation, and more discovery. Another role of our professional societies is to assist with career development. If we go to any of the national meetings, you'll see that there are job fairs and there are opportunities to interview with potential employers. It's there are job fairs that come across outside of our national meetings as well. Think in the journals, think of all the job applications, opportunities, and those all stem from our initial involvement in these societies. The other thing about these societies is they provide us with an organized voice for our collective representation. They advocate on our behalf. If you think of an organization like the American College of Radiology, they advocate on our behalf with the Congress, certainly with federal and state agencies, with a variety of legislative bodies. A lot of the accomplishments that we've made in terms of radiology with regard to billing and compensation and codes of ethics have come from the American College of Radiology. Another important role in these societies is to promote health services research. This gives us plenty of opportunities to develop research that will benefit all the patients. And this will also in turn help us to implement important steps in healthcare reform. Another one of the very important roles for our organizations and our societies is the role in establishing standards. If you think of what the American College of Radiology has done with the appropriateness criteria, this is a way to develop a tool for our clinicians, our collaborators, to develop skills around what's appropriate to order in what particular clinical scenario. Been a tremendous step for us in terms of quality. Think about the Image Gently and Choosing Wisely campaigns. These have been instrumental in allowing us to provide, again, our clinical colleagues with appropriate steps that limit radiation dose. Many of the organizations have come up with codes of conduct and ethics. As we talk back to the original meeting of the American Medical Association, you can realize how important it was for them to set a code of ethics for us as a group of physicians that manage ourselves autonomously. The Radiological Society of North America, the American Röntgen Ray Society are some examples of other groups that create codes of ethics for the members of their societies. These societies have also helped us with managing conflicts of interest, where our professional responsibilities might be compromised by our external interests. And I think they've spent a great deal of time helping us focus on how to manage those conflicts of interest and what those conflicts of interest are. Many of these societies have also played a very important role in helping us deal with human subject research. If we think back to the unfortunate days after World War II and the Nuremberg trials, and we realized that the Nazi concentration camps were grounds for experimentation that was done without consent. And I think that all of the organizations have been very focused on helping us provide better tools for us to perform ethical human subject research. And I think in research in general, if we think of attending the meetings, we're always looking at the state-of-the-art science. These meetings are always trying to highlight where we can push the edges of medicine. I think one of the other important roles of some of these societies is they help us with leadership training. I think in the course of some of the other sessions that you're going to see on this videotape, you're going to hear people talk about leadership. A lot of that leadership was cultivated at these national meetings and through these professional organizations. Another important role for these societies is they provide us ongoing education. They talk to us about professional obligations. When we look at some of the meetings and conferences and we think about where are we going to get continuing medical education credits, where are we going to take self-assessment modules, these are very difficult and I would say impossible to do on our own if it were not for the affiliation we had with professional societies and organizations. The journals that all of us read are critical to furthering our knowledge in the specialty of radiology. Well, all of these journals come through publications from our professional societies and organizations. And if we talk about board certification, as I mentioned earlier, the trustees of the board, who are volunteer workers, are all nominated by a variety of our societies. Another important role for our societies and organizations is that they serve as the mouthpiece for radiology in terms of communicating to the public. When we talk about dangers of radiation, if you go back 15 years ago, we weren't talking about the dangers of radiation. But now, organizations such as the RSNA, the American College of Radiology, the Röntgenray, the Society for Pediatric Radiology, one of my organizations, has all done a yeoman's job in communicating the risk of radiation to the public, and this has driven down our use of potentially dangerous ionizing radiation. The values of screening mammography, although you've seen those values debated in recent years, the public learns about the importance of these screening examinations because of our professional organizations and how they communicate that message. So I think in the end, what we're really talking about is the importance of being a member of your professional organizations and your associations, because only through your membership can we improve value in healthcare. Thank you.